Hi. So could you firstly introduce yourself and then present the Rancho Los Amigos National Rehab Center?
Sure. My name is Kelley Kubota, and I am a physical therapist at Rancho Los Amigos National Rehabilitation Center. We're basically a county facility in the county of Los Angeles in California. We see patients with a wide variety of diagnoses: stroke, spinal cord injury, brain injury, pediatrics. We see patients in outpatient.
You have presented during the conference the Rancho Los Amigos gait analysis form sheet. Do you have how do you use it in your clinical practice?
That's a good question. So I have a little Rancho Los Amigos, the observational gait form in my head as I'm going along, only because I've seen so many patients walk over a very long period of time, many, many years. But we do use it to help some of the newer clinicians or some of our students develop a systematic approach to analyzing gait so that they have a way to see what's going on at the ankle, see what's going on at the knee, the hip, the pelvis, and the trunk.
Okay. And do you make the same kind of evaluation for other activity of lower limbs, such as sit to stand, ascend, descend stair, or running?
I would say we don't have a formal form per se, but when you think about observational gait analysis and think of it like a movement analysis and really trying to hone your skills about what is really going on from one joint to the other, I would say that for a sit to stand or doing a transfer activity, we're really doing a movement analysis. So I think the problem solving between one and the other is very similar, but I don't think we have a form. We don't have a form.
Okay. And some clinicians argue that the use of brace inhibits muscle activity. What do you think about that?
I would say that the research out there, and that is a big question here. People are sometimes afraid to use a brace because they do think that it inhibits muscle activity or recovery. But I think there is plenty of evidence out there that suggests that the timing of the muscles, such as the gastroc, are basically turning on when they should turn on during the gait cycle. And so I would argue, with the exception of perhaps tibialis anterior, that the muscle timing is still happening when it should, and that with using a brace, we actually can promote recovery by having people walk further, walk faster, have more opportunities to practice.
Okay, and do you think it's complementary to the use of neuromuscular electrical stimulation?
Yes, I think using e-stim when indicated, I think can certainly help a person's walking. It can help with activation of muscles. It may help with just some of the sensory feedback. We also use it for strengthening. So I think it's a great tool to include in your interventions.
Okay, and finally, I heard about a new application you have developed at the Rancho Los Amigos. Could you tell us more about this?
I would love to tell you about the Gait app because I'm a giant gait nerd and I love gait. And this is something I've been working on for the last several years. So the app is something that you basically have a video capture for many of the gait deviations that you see. So basically the Rancho gait form, the observational gait analysis form, for every deviation that's listed on that form, there is a video capture that explains what that particular deviation is. And it can be used with newer clinicians or for students who are just learning gait and want something to help them, a video to actually help them learn the concepts. But it can also be used for someone who just wants a brush up of their skills for gait, just something to look at that will tell them, oh, what is excess plantar flexion, and then they can look at the video capture for that.
Okay, thank you. Thank you for giving me a bit of your time, and hope to see you soon in France.
Thank you very much.